Have you ever been in a situation where you come to a room and the environment feels tense? Well, feeling this tense, stressful air is part of our instinct, it's part of our animal nature. My name is Carlos Gomez, I'm a pediatric dentist, and I would like to share with you a study which makes us understand how we are contagious. We are constantly sending and decoding body language signals. We do this not only emotional, but also chemically. This study may sound disgusting, but I think it was fascinating what they discovered. In this study, researchers collect some sweat from people who was running on a treadmill and people who was skydiving for the first time. Then they asked some volunteers to smell the samples when they were in an MRI machine. Without knowing what sample were they smelling, it was discovered that the skydiver sweat smell triggered a response in the brain region associated with fear, the amygdala. But the treadmill sweat sample did not. This means there's a connection between our body reactions and our emotions. It also means that these emotions are contagious. Our fear is contagious. Our confidence is contagious. Anxiety is sometimes we usually deal with when we have to face a child for the first time and we know we are about to perform a medical or dental procedure that will be uncomfortable. So, if our emotions are contagious, we have to attempt infecting people with the right ones. We can use our nonverbal communication to be contagious and express the right message, the message that will help us to manage the behavior of our pediatric patients. We can use facial expressions. What is interesting about our facial expressions is they cause our emotions. If we have a facial expression of fear, when people look at us, they will ask, what's going on? What's happening? Our facial expression will cause fear. It's contagious. But not only negative emotions are contagious, also positive emotions are contagious, like a smile on your face. An authentic smile will have a happy effect, expressing your confidence, will be contagious, and you will become more likable. We also communicate verbally. Here we have to consider the tone we use, the volume we use, and the words we use. It is important to have an enthusiastic, positive tone of voice when we approach our pediatric patients. Make sure you are communicating positively with them. Your message should transmit that something good is about to happen, that you are confident, that all will be fine. When we communicate verbally, we use words, and we have to select these words carefully. The words we use should not cause any anxiety or fear on the child, but should still communicate with him or her on an understandable language for their age. We can use sleepy juice instead of local anesthesia. Instead of say pain, use the word discomfort. Instead of say distraction, we use wiggle the tooth. For instance, I say to the kid before I do the extraction of the tooth, hey buddy, I'm going to wiggle your tooth, and if it is loose enough, I'll give it to you for the tooth fairy. But if it's not loose enough, I will leave it there. Guess what? They always leave with a tooth for the tooth fairy. Do you think is it possible to predict children's behavior? Well, for me, that would be a superpower. I want to offer you a free non-tech life hack. And all it requires of you is 2 words that will make easier to manage the behavior of your pediatric patients. My first word is okay. To make it clear, this word used as a question or looking for an approval should be out of our vocabulary when we are expecting a determined response dealing with children. If you use it in this context as a question, you are giving the child the option to say no. For instance, you ask the child to sit in the chair for examination. Hey, Tony, I want you to sit in the chair so I can see your teeth better, okay? Well, now Tony knows he has an option, and he most likely will say no or will refuse to sit in the chair. On the other hand, we should use the word need to communicate our commands to the child. For example, we will ask Susan, Susan, I need you to sit in the chair so I can see your teeth better. Notice there's no questions. You're not giving the child an option. Joe will sit in the chair. In general, we have basic behavior guidance and advanced behavior guidance. The advanced behavior guidance is what we use when all our basic behavior guidance fail. And that's when we use general anesthesia or we use conscious sedation. As part of our armamentarium on the basic behavior guidance, we have techniques such as nonverbal communication. This means body language, posture, facial expressions, and emotions, and also chemical signals. Among these basic techniques we commonly use is the tell, show, and do. This technique involves verbal explanation of the procedure in a phrase appropriate for the patient's age. This is the tell. Then we do the demonstrations for the patient of the visual, tactile, and auditory in a non-threatening setting. This is the show. And lastly, we complete the procedure without deviating from the explanation. This is the do. This technique requires communications skills, verbal and nonverbal, and also a positive reinforcement. Make sure your chemical signals are not from the skydiver sweat. Among other basic techniques is also distraction. This is when we divert the patient's attention from what we may perceive as an unpleasant procedure. We may use storytelling or videos. For storytelling, you can ask your patient if he or she has a pet, and then make a story about your pet or her pet. For video, we use TV screens on top of the dental chair or across the wall, the room when we play movies. The last behavior guidance I want to share with you is something I call suggestion. As far as I know, this is not described in any literature I have read, but it works very well for me. It consists in telling the patient that the procedure we're about to perform is very simple. For instance, I tell my patients after he or she is sitting in the chair, "Hey, Johnny, let me see your Spiderman teeth." I look at them. I see a huge cavity, but my next phrase is, "Oh, buddy, this is going to be so easy. Your cavity is so small, so we won't have to do much. You'll be out of here in no time." You have to see the face of Johnny after he heard that. His face is relaxed. All this information will help you to obtain optimal results like this. Thank you.